Thank you, Dr. Fatemi, for putting this together. And thank you when you introduced me that you mentioned that our mission is to serve New Mexico, specifically in the area of behavioral care. And one of the issues that we need to really address is the substance use disorders. So what I'm going to do today is actually not talk about psychedelics. That's going to be for our experts, and I am not an expert in that area. What I'm going to talk about is about the needs that we have in our state, and in what way can UNM contribute. And again, a major need is with addictions. So thank you again, Dr. Fatemi, to working on this and for putting this symposium together. Thank you so much. So this is the vision and mission of UNM. Of course, the key thing is to collaborate with community partners. And in terms of education, workforce development is key. And that's a big responsibility that we have with the state. We need to train more providers who are going to treat those who suffer from substance use disorders. And that's not just MDs. Psychiatrists is less than 10%. It is the whole workforce that includes many individuals. We value collaboration. And what are the focus areas of, this is UNM. Well, as you can see in every single one of them, and let me repeat it, this is the focus areas of UNM, Health Science Center. Our department is involved. Certainly, child well-being. We've mentioned behavioral health and substance use disorders, healthy aging, for sure, and workforce development. So our department is, of course, invested in all of these areas. So what are the needs of our state? We got a lot of needs, and again, I'm going to focus on behavioral care. I think what is key is, in terms of our needs, is to think more as a continuum of care. In other words, the right care or the right treatment for the right patient at a particular time. And this applies to all in behavioral care. You have anything from treatment at home. We need to be patient-centered. We need to go where the patients are. We need to work with the community, and that includes education. And then if you look into what are the needs of our patients, and a sense, that means the treatments are to take care of more acute conditions. So you have outpatient care. And then even if you think of a particular patient, most of the time the patient is going to be in the community, some outpatient visits. And the highest acuity would be a visit to the psychiatric emergency room, and followed by inpatient care. And then some individuals, most of them go back to their homes, but some need residential care. So when we think of our needs of our patients, it's not just the hospitals, it's outpatient, it's intermediate level of care, and that is an area that we really need to expand. Intermediate levels of care. Of course, we need good hospitals for that acute, to treat those acute episodes. So what are the facilities, what are the resources that we have in the department, and for that matter at UNM hospitals? I'm saying plural because it's not only the one in Bernalillo County, we also have another facility in Sandoval County, SRMC. So what do we have to offer? And let's talk about our missions. So patients are first. So of course we need to provide the best possible care to our patients. We should focus. We can't treat everybody in New Mexico. We just can't. We don't have the capacity, and we shouldn't treat everybody. But we would treat the most complicated patients who others don't want to treat because perhaps has to do with funding. That's not an issue for us. And complicated patients, and that includes many of our serious mental illness patients suffer comorbidities, not only mental health disorder, but also substance use disorder. We need to train those who are going to be taking care of our patients. So we're very thoughtful in terms of who we will train, who's going to be a good fit. As every program in the country, we get over 1,000 applicants for a residency training program. Let's focus on the residents. We interview about 100, and then a focus is who's likely to benefit New Mexico. And a key thing is staying in New Mexico. But we also want those who come from other parts of the country to go back there and then keep sending us good candidates for our training programs. And diversity is always key. We want to make sure that in our faculty we have faculty who train with us and those who trained elsewhere. In terms of research, as the only academic center in the state, research is key. Without research, of course, our treatments would not improve. We focus on those areas that are going to benefit New Mexico. In other words, addiction, or the primary need in New Mexico, addictions is key. So our research, that's a key area that we want to focus on, research in addictions. Again, Dr. Fatemi, thanks for putting this together. Community engagement is key. Again, thank you for putting this together. And the community, it's of course other providers in the state, but also the public and other partners in the community. It is key that we don't have a lot of funds, so we need to optimize our resources. We are a medium-sized department, 89 faculty, 77 staff members, actually trainees, 81. We have residency in general psychiatry, fellowships, a number of fellowships. We have training also for psychologists, an internship. We have postdoctoral trainees. And here are the fellowships that we provide. And as you can see, addiction is key. We also have a non-ACGME approve. It's because ACGME does not approve reproductive psychiatry. That it all exists, but it's not under ACGME. Addictions, adult general psychiatry, these are divisions, child, geriatric, primary care, psychological sciences, neuromodulation. And this is also key. Yes, we need to provide care to our patients, but also we need to bring the latest techniques that are available nationally or globally, and neuromodulation is certainly an area. And community behavioral health, a key division for us. This is what gets us in contact with our community. And as you can see, we have folks working in different parts of the state. We are actually a key partner with Indian Health Services. As you can see, these are education mission. These are services that we provide across the country, as far west as the Aleutian Islands and as far east as Manhattan. In terms of our education, as mentioned, we want to train those who are going to stay in New Mexico. We try to keep 50% of our graduates. We've been able to do it. We also need to make sure that we develop the latest therapeutics. We need to make sure that we have a diverse training environment for our residents, for our fellows. Our medical students highly value the training. And also a key point is that within the department, it is also our mission to train other disciplines. We work very closely with the College of Nursing. We participate in the training of nurse practitioners. We also work with a physician assistant group. Actually, the other one is ECHO, a key partner with ECHO. And this actually has one of the key programs that we have is education of law enforcement agents, CIT ECHO. We see law enforcement as a partner. Many times, patients with need of behavioral care, they're not going to be, the first contact is not going to be a hospital provider, it's going to be law enforcement. So it is key for us that they're educated in terms of behavioral care and that we provide training. And I'm focusing right now on our law enforcement agents. Now, so do we have enough psychiatrists? No, we don't. So green is good, red is bad. So as you can see, we need more psychiatrists in the state, but our goal is not to have a psychiatrist in every corner of the state. It's not ideal. We don't have the capacity. What we want is to work with folks in different parts of the state. Primary care services are key. So we can serve as a consultation service. We also need to train, as mentioned, more nurse practitioners, PAs, who are going to be moving in different parts of the state. So training psychiatrists is just a component. It is not the goal to have a psychiatrist in every single corner. Now, in terms of the services that we provide, this is in terms of the hospital. As you can see, large, over 500 FTEs, and that includes psychiatrists, psychologists, psychiatric nurse clinician, counselors, social workers, and a key group is peer support experts. And these are individuals who suffer from the condition, and so they can provide support to our patients that we can't unless we've suffered from the condition as well. And addictions, the area of addictions is key in terms of us peer support. Now, in terms of inpatient care, we have a psych hospital for children. It provides care to 35 beds, adults 32, geriatric we have 15. There is 35 for child psychiatric inpatient care. We are hopefully going to be getting funding for a new hospital. The governor has signed, but as many things that have been approved by actually not only the governor, but also the legislators, has to be approved by the community, and that's going to be decided in the vote in November. Another key thing is the continuum, and that is the providing services when patients need them. Get back to psych emergency. On this past Monday, we had the groundbreaking ceremony for a new crisis center, and that's going to be completed a year and a half from now. So this is going to be great for our patients. In terms of outpatient, of course, it's the continuum of care. For addictions, we have the acronym is ASAP, Addictions and Substance Abuse Program. We work closely with other departments. Clearly, Milagro program is an example. And there we treat, as I mentioned, we can't treat every single patient, but we're going to treat those who are the most vulnerable and those more difficult to treat. And that, of course, is going to be pregnant patients who have substance abuse. Rehabilitation is also key. So we have a psychosocial program, community-based program. And CareLink is a service that is provided to our patients with who have social needs. Peer services, I already mentioned peer services. Now, in terms of specific treatments, we mentioned neuromodulation, TMS, also ECT. ECT at some point, maybe 50 years ago, more in the 60s, it was seen as something barbaric, but it's actually a very good treatment. And with research that has been done by one of our faculty members, Dr. Abbott, it is now more precise in terms of the part of the brain and also in terms of the intensity. So many patients have benefited from the electroconvulsive treatment, and it can be done inpatient or outpatient. Another new treatment is ketamine. Esketamine is a nasal form for ketamine that literally can be life-saving. And these are all new treatments that didn't exist a decade ago. So we treat a lot of patients, as you can see. In fiscal year 20, 23,000, I guess, encounters. It went down a little bit with COVID. And that also look at the methadone. Methadone, we went down a little bit, but many visits. Collaborations are key. And again, this is an example. The crisis center, we're doing that in collaboration with the county. And that's going to be, as mentioned, completed in a year and a half. And that'll have an expanded observation capacity. What does that mean? So many times we have a patient who suffers from let's say, primary psychotic disorder, and actually the majority of those patients also have comorbid substance use disorder. So when a patient comes to the psych emergency service, we don't know if it's an exacerbation of the condition or if it's intoxication by whatever substance stimulant. And how can we tell? Unfortunately, only time can tell. Well, of course, we can do the toxic screen, but by having this observation capacity and the patient recovers from the intoxication, that will avoid inpatient care that is needed when it's the primary psychotic condition have an exacerbation. Transition age is key. Unfortunately, substance use disorders starts early on, and many times it doesn't go away. So this is a vulnerable age. A developing brain actually can suffer from with the use of different substances. Something that we're paying close attention is, of course, that as we know now, cannabis, marijuana can be used recreationally. Was that good or bad? I think it's good because we want our law enforcement agents not to be arresting teenagers using marijuana, but rather the drug traffickers. On the other hand, let me emphasize, many studies have shown that marijuana in adolescents actually leads to poor outcomes. Patients who are vulnerable to develop a psychotic condition, the age of onset is going to be younger if they use marijuana, and the younger the age, the worse the outcome. So as everything in life, it has pros and cons, so we have to be very careful, even with a substance like cannabis. And yes, we are seeing more adolescents in the psych emergency service, adolescents who had no psychiatric condition, and they come to us with suicidal thoughts. Now, we talk about long COVID, right? And I'm talking in terms of the infectious condition. But let's again not forget about long COVID in terms of behavioral care. So this is a big trauma. So how long will it stay? And in fact, we don't know. So this is something that we're paying close attention. I mentioned already the need for intermediate level of care. That is not outpatient, not inpatient, but partial hospital, major need in New Mexico. And we need a number of things to change, including the reimbursement. And actually, we don't have residential programs at UNM, but at the for-profit sector. So if they don't get the reimbursement, they won't establish business in New Mexico. So there's many things that need to change in order to provide more treatment for our patients. That includes other programs as the so-called living room model and expanding the peer services. Now I mentioned the crisis center. I mentioned is going to be opening a year and a half from now. Again, it's going to be great for our patients. As mentioned, is going to have the observation area, the living room, and it also have a component of the being able to see patients in the emergency services. So it's the observation, but also the emergency assessments. And again, when patients come to us with intoxication with whatever substance, we can watch them there and then ready to move them to the next level of care. Okay, what are the challenges? What are the gaps? What are the opportunities? There's concerns. Concerns, are we taking care about our patients, including their safety? We need more forensic services. Many times our patients, instead of being hospitalized, they are detained. Sometimes they get the treatment in jail or prison, sometimes they don't. So that is a key component, working closely with our law enforcement agents. We also need to, we've seen that the length of stay of our patients has increased. We need to make sure that we can move them to different levels of care, not inpatient, intermediate level of care. This is an interesting graph that I'm going to show you now. Whoops. As you can see, this is the length of stay. It's going up, and the problem with increasing length of stay is that we have limited number of beds, so we need to move patients to an intermediate level of care and have the inpatient just for those who suffer from the acute condition. Gaps. I've already mentioned residential. Unfortunately, including substance use disorders, this is sometimes it's not curable, at least now. So unfortunately, sometimes we do need the residential, we need the partial, we need more intensive outpatient, we need community-based forensic services. I mentioned already that the reimbursement mechanisms need to change. Another one that I haven't mentioned is licensing. In order to bring people from out of state, we need to make sure that this is done in an expedient and with efficiency. We also need the transition age services for adolescents. Opportunities. We need to reach, I guess, patients, families, all across the state. Project ECHO, I'm sure you're very familiar with it, is something that UNM has exported to the world. And it is not telemedicine in terms of one provider and a patient. It is telementoring, where the experts can help others in the community treat patients or enabling groups in the community to advise each other. So this is something that we're working strongly with. And this is what's going to help with also with our workforce. It's not only initial training, but it is helping with the latest advances. And ECHO has, there's evidence that it has helped with substance use disorders. This is the improvement of treatments, availability of treatments in New Mexico with the ECHO program. This is the rest of the country. So sometimes in many statistics, we're seen as the bottom three. In some cases, like this one, quite the opposite. Let me emphasize also the rural, that we need to make sure that we help our primary care providers. We not only in terms of specialty, you could argue addictions is a subspecialty, but we need to bring it to the primary care providers. We need to focus also on behavioral care for children for many reasons. It's of course the future. And let me give you some statistics here. So this is the use of illicit drugs as you can see, this is 2015 to 2017. So the illicit drug in New Mexico increase is 13% higher than the rest of the country. Okay, And that actually, we're not doing any better, as you can see. So this is a need that we have that is much larger than in any other part of the country, including our region. Now, depression, I've mentioned the COVID. In 427, this is the prevalence of depression, 10%. Now you see 16, 19, that has increased. And of course, we want to see 19 to 22. So the use of illicit drugs has always been high, but now in addition to that, we have an increase in depression. And again, I'm focusing on adolescents. This is another key point in terms of the need of our children. In New Mexico, there's close to 20% of patients who experience an episode of depression. And also 40% of high school students in New Mexico had at least a period of sadness or hopelessness. 40%, that's really alarming. So the need for our children is very high. Psychiatric conditions can be lethal, of course, death by suicide. And that also we do quite poorly, close to 15%. That's the leading cause of after unintentional injury. They're tied 15 per 100,000 compared to we're actually the double in the rest of the country. Really a tragedy. In terms of attempts, 10%. The rest of the country, less than 9%. And of course, we're a minority state, and these are social determinants of disease. And the suicide attempts are actually higher in, I like the term minoritized, because that means that even if it's the majority, the services, the people from minority communities are being minoritized, meaning they receive less than the rest of the population. 16% planned suicide in the last year. This is really very, very high. These are the needs that we're going to have. We do have needs in inpatient, and again, I'm focusing on child, but the major need is also, it's actually with outpatient services. Back to substance use disorder. So this is forecast, and this is what we forecast for children. And as you can see, it's an increase, okay? And this is, as you can see, also an increase in terms of substance use disorders in adolescents in our state. Because we tend to think, when we talk about addictions, we usually talk about adults. But again, children are vulnerable, developing brains, and of course our future. So this is an area we actually, let me get back to the program just for a moment, our department. We do have a clinic, it's called the STAR Clinic, where we provide addiction services for adolescents. We, of course, have a lot of work to do there. I am going to round up my presentation now to leave time for any questions. I will stop sharing my screen, but because I want to just give a last message. Substance use disorder is a major problem in our state, and as I emphasized it at the end, adolescents, children is a major concern. We need new treatments. So again, Dr. Fatemi, thanks for putting this together. Now, sometimes treatments, there's pros and cons. So we need to be very, very careful. We need to make sure that the benefits always outweigh the risks. And this, of course, includes the topic of our symposium today. Thank you, Dr. Fatemi, and thank you, colleagues, public, for being here with us today.